All right, welcome to The Explainer. Today, we are diving into a really fascinating drug called teriparatide. It's one of our most powerful tools against severe osteoporosis, but here's the thing. It works in a way that seems to completely defy logic. So let's get right into it. And right off the bat, here is the central puzzle we're going to solve today. The very same type of hormone that, in high amounts, can actually weaken your skeleton is the key ingredient in a drug that makes it stronger. It's a total medical paradox. And the answer, as you'll see, is all about timing. Okay, so to really get our heads around this paradox, we first have to see where teriparatide even fits into the picture. It's not like most of the drugs you probably heard of for bone health. It's playing a completely different game. Think of it this way. There are two main strategies against osteoporosis. Most of the common drugs, things like bisphosphonates, they play defense. They're called antiresorptive, which is just a fancy way of saying they hit the brakes on the cells that break down old bone. But teriparatide, it's what we call an anabolic agent. It plays offense. Its entire job is to actively build brand new bone. So what is this stuff exactly? Well, teriparatide is basically a bioengineered piece of a natural human hormone. That word recombinant just means it was made in a lab using some pretty smart genetic technology. Scientists figured out which part of our parathyroid hormone was the most powerful active segment. Turns out it's the first 34 amino acids, and this little fragment is the secret to its incredible bone-building power. And this brings us right back to that core mystery. How on earth does this little piece of a hormone do the exact opposite of what the full hormone does when it gets out of control in the body? And here, my friends, is the heart of the solution. If your body has constantly high levels of this hormone, like in a condition called hyperparathyroidism, your bones get weaker and weaker. It's a continuous, non-stop signal to break down bone. But teriparatide is given as a short, sharp, once-a-day injection. This quick, intermittent pulse completely flips the script. It tells the body to build bone instead. So you see, it's not what the signal is, but how that signal is delivered. So how does that daily pulse actually translate into new bone? This is where the biology gets really, really cool. So that daily injection, right? It creates this quick little spike in the bloodstream. This spike zooms in on your osteoblasts. Those are your body's dedicated bone-building cells, and it plugs into their receptors. This acts like a huge wake-up call, activating all these pathways inside the cell that basically shout, it's time to build. And the osteoblasts, they get right to work, laying down new bone material at a way faster rate than usual. And the result isn't just more bone, it's better bone. Teriparatide doesn't just bump up the density numbers. No, it fundamentally improves the internal structure, the microarchitecture, making it more connected and way more resilient. It also thickens up that hard outer shell of the bone. All of this together just dramatically enhances the bone's overall strength and makes it much tougher to fracture. Now, with that kind of power, you're probably thinking, why isn't everyone with osteoporosis on this stuff? Well, its uses is actually very specific. So let's take a look at who it's for and just how well it really works. Yeah, this is absolutely not a first-line therapy. Because of its power and its cost, teriparatide is saved for patients who are at the absolute highest risk. We're talking about people who have already had fractures from osteoporosis, folks on long-term steroids that are just eating away at their bone, or patients for whom other drugs just haven't worked. It's really a specialized tool for the most severe cases. But for those patients, wow, the payoff is staggering. In clinical trials, teriparatide slashed the risk of new spinal fractures by a massive 65%. And these are the kinds of fractures that can cause just awful pain, loss of height, and really serious disability. And the protection doesn't stop at the spine either. The drug also cut the risk of other fragility fractures, like the hip, the wrist, the pelvis, by more than half. This just goes to show its powerful system-wide effect on strengthening the entire skeleton. But, as you can probably guess, a drug this powerful comes with an equally important set of rules and potential side effects. You just don't get this kind of benefit without some very serious considerations. Okay, so the more common side effects are generally pretty manageable. Some people might feel a little dizzy or lightheaded right after an injection, maybe get some leg cramps or nausea. It can also cause a temporary, very brief spike in blood calcium levels. And of course, since it's an injection, reactions right at the injection site are also possible. Now for the big one. There is a black box warning on this drug. Here's why. In studies where rats were given very high doses for basically their entire lives, there was an increase in a type of bone cancer called osteosarcoma. Now, it's really important to say this has not been seen in humans. But as a strict precaution, regulators put that warning on there. And this leads to a critical rule. So because of that potential risk, however small, there's a very clear no-go list, people who should not take this medication. This includes anyone with a higher risk for bone tumors to begin with, like those with Paget's disease or who've had radiation therapy to their skeleton. It's also not for people with already high blood calcium or severe kidney problems. And finally, it's not for kids or young adults whose bones are still growing. And this brings us to that critical role I mentioned. This is a big one. A patient can only be treated with teriparatide for a maximum of 2 years. That's 24 months total over their entire lifetime. It's a one-time, 2-year therapeutic window to rebuild as much bone as possible. And all of this really points to the modern strategy for treating severe osteoporosis. You use teriparatide as a powerful short-term building phase. For 2 years, you actively construct new, stronger bone. Then, once that course is done, the patient is usually switched over to an antiresorptive drug, one of those defensive agents we talked about, to lock in those gains and protect that new bone for the long term. It's a brilliant 1-2 punch against some of the worst cases of osteoporosis.